What is rosacea? It is a long-term inflammatory skin condition affecting the skin barrier and its function. It affects around 1 in 20 people, and although anyone almost of any age can be affected, it most commonly affects those with fairer skin types and also women more than men, particularly presenting in the age between 30 and 50. There's a number of clues that might point to you having rosacea. First of all, with the signs that you might present with, you might have facial redness, there might be these tiny visible capillaries called telangiectasia, and also acne-like spots. One of the key signs and also symptoms is flushing, and other signs that you might experience, other symptoms, that you might experience are skin irritation, hypersensitivity, and a burning sensation, particularly if you're having a flushing episode. Flushing episodes, a very important feature is that typically they should last for more than 10 minutes to be suggestive of rosacea. There are 4 subtypes of rosacea. One of them is ocular rosacea, which affects the eye, and symptoms that you might experience if you have this are burning, redness, tearing or dryness of the eyes, a feeling of a foreign body like if something's in your eye, and also sometimes blurred vision and light sensitivity. But in fact, 50 to 70% of people with rosacea will have some eye involvement. Sometimes there is an overlap between conditions, so it may not be that you don't have rosacea, but it may be that you've got something else as well. But one condition that it can be mixed up with is seborrheic dermatitis. This is very common. Between 5 and even 20% of the population may have some of this, and this again affects similar areas of the face, but often affects the nasolabial corners, which is here, and gives you this kind of scale and this redness and burning sometimes. It can affect the eyebrows. It can be in the ears, causing itchiness in the ears, and sometimes even affect the chest area and certainly the scalp. And in fact, seborrheic dermatitis is one of the most common causes of dandruff. So if you've got some of these signs, it may be that you have that and not rosacea, or indeed it may be that you have both conditions. So you do need to see a skin specialist to try and work out what actually is causing your problem. The common triggers for rosacea are alcohol, extremes of weather such as sunlight, windy conditions, spicy food, hot baths, hot showers, and of course the big one, stress, which flares up pretty much any skin condition there might be. Of course, you don't necessarily need to tick all the boxes, so don't think you haven't got rosacea just because you don't have any of those obvious triggers. Something you can do on a daily basis to help your rosacea is 1, wearing a zinc oxide based sunscreen. Sun is a very common trigger factor for rosacea. So by wearing a zinc oxide, 1, you're going to help give yourself the best protection against UV radiation. But secondly, zinc oxide is actually an anti-inflammatory, which means it's going to help dampen down that key process that's going on in your skin. There's a number of ingredients which actually ironically help or potentially help rosacea, but can actually sometimes in certain forms or concentrations flare up skin. So you may be doing something that you think is going to potentially help you, but it could be doing the opposite. For example, vitamin A. So any of the retinols or similar agents, actually vitamin A is very crucial for people with rosacea. However, a lot of these forms and concentrations that are used in formulas can actually cause some inflammation and some dryness and irritation of the skin, making your skin barrier function worse rather than better. There are new generation forms of retinoids, such as one that we use in Solderma, and actually this can help repair the barrier whilst giving you that essential vitamin A derivative that your skin needs. Another example is vitamin C. Vitamin C is an anti-inflammatory and antioxidant. It really is very good for rosacea. However, one of the most commonly used forms, L-ascorbic acid, in at least 10 to 15% of the patients I've seen, can flare up their skin, even if they don't have rosacea, but just have some sort of sensitivity. So it's really the form of the ingredients you use, not just what type of ingredient you see on the bottle that's important. Lastly, acids. A lot of the exfoliating acids can sometimes be too harsh for the skin, but again, it doesn't mean you can't use them. It's just using a product in the right form. Inactive ingredients is often something that's overlooked, and again, it's the inactive ingredients in a lot of formulas that can actually flare up your skin. So I would say really focus on something that's going to be anti-inflammatory, have added antioxidant protection to protect that skin barrier function, and of course moisturize. If you have a good non-comedogenic, which means non-spot inducing moisturizer, that will really help with repairing and restoring your skin barrier function. There are a number of treatments that can help with rosacea. First of all, your primary care doctor can give you some options. Most of these are based around some form of antibiotic use, whether it's something like metronidazole gel, which can be used on the skin directly and is my preference over taking some oral antibiotics. But really, a lot of the options within the NHS are going to be very antibiotic based. That's something that I'm not a huge fan of, although you should always follow your medical professional's advice. So I tend to opt for things that are going to work more at the inflammatory level. And of course, adding those key ingredients like vitamin A is crucial as long as you use the right form. Lastly, there are more specialist treatments, such as one that can be given to just really give a cosmetic benefit by reducing the redness down, and it works for about 6 to 8 hours in the day. And for those who really do have that significant social impact from the redness and flushing, drugs like this can be quite useful to help you get on with your life. Unfortunately, rosacea doesn't have a cure. We don't really know the cause, although there are some good theories. So really it comes down to trying to control the amount of flare-ups you have with good skincare protocols, working really on that inflammation and protecting the skin barrier function. And of course, reducing or ideally avoiding all those key triggers from UV sunlight to spicy food to alcohol, whatever it is that you've identified flares up your skin. That way you can hopefully enjoy good, healthy skin and good barrier function with minimal flare-ups. Your diet could potentially affect your rosacea. Certainly, we've already mentioned that spicy food can be a trigger for many, and of course alcohol is the big one. But again, there are certain diets that are promoted for just general good skin health, and these are kind of called anti-inflammatory diets, so avoiding highly processed foods, high sugar containing foods. That really, I think, just promotes good skin health rather than specifically focusing on rosacea only. When you should see a dermatologist, I think partly depends on where you live in the world and what local services you have. Certainly in the UK, your first port of call, if it wasn't a clinic like this, would actually be seeing your primary care doctor or nurse. But then if you really can't get it under control, then a specialist referral may be warranted. If you have direct access to a dermatologist, that can of course be very useful. However, in many instances, you may only be offered a very small percentage of what actually can be done for rosacea. At Perfect Skin Solutions, we offer a number of really effective treatment options for rosacea. Firstly, intense pulse light, IPL. I must put a warning out there though, that there are only a very few IPL devices that I would think safe enough and effective enough to use on something like rosacea. In principle, what our device does, which is Lamecca, is that it throws pulse light at the skin. These wavelengths are preferentially absorbed by the red in your vessels, thereby shattering the pigmentation and reducing those vessels down overall, and therefore your redness, and thus less vessels means potentially less flushing as well. The other really effective treatment is our N-peels. This is a chemical peel program which contains numerous anti-inflammatory ingredients, as well as something called mandelic acid, which can really help with reducing down the symptoms and signs of rosacea. And of course, lastly, what you do at home, and the skincare protocol that we would advise here will complement things you have in clinic. If your rosacea suddenly got worsened, please don't be concerned, but it's worth looking at the last couple of weeks thinking what could have caused this. Stress is without the doubt the number one cause, and sometimes we forget how much stress does influence the health of our skin. But then try and think of other triggers. Have you been exposed to new triggers recently? Have you had lots of parties and been drinking more alcohol than usual? And usually you'll work out what's caused this problem. If you still can't do that, then you might need the assistance and input of a medical professional or a skin expert to actually help you work out what's going on with your skin.